What I'm going to talk about, and kind of wear two hats here. I'm the director of EMS, and many of you that may know me also know that I'm a deputy coroner. So, unfortunately, with the drug epidemic, these two things kind of go hand in hand. So, we'll kind of talk about particularly the drug epidemic, and what they really want me to talk about is how COVID had impacted it or changed it, and it certainly has. And we'll kind of get into that as we go through this talk. Appreciate everybody attending today, and I appreciate the invitation to share this information. Unfortunately, a lot of times the information I share is not good information. It's just statistical information, and it's not just statistics. Every one of these numbers I'm going to share with you today is a person. So I don't want anybody to get caught up in the numbers or the lack of numbers, but every one of these numbers is somebody, and that somebody's important, and it's somebody that we've lost or has at least suffered an overdose, and this is somebody who's needing help and reaching out to help. And kind of piggybacking on what Judge Taylor said is we've got to do better about providing that for them, and I think we're heading that way. We got a long way to go, but I think we're certainly moving in the right direction. Probably everybody's heard about this, that all through COVID, a lot of people say we're all in the same boat. And then I think that phrase kind of got corrected, and I stole this off the internet. So kudos to whoever actually did this. But we're not in the same storm. And I think that is very important when we look at substance use disorder and overdoses and things like that a lot of those folks were probably impacted at a greater degree than a lot of people. There's folks that the COVID-19 epidemic didn't impact much at all. They maintained their job, they maintained life as pretty much usual. The only impact they had is maybe wearing a mask, and maybe a few places they wanted to go, they couldn't go, but the impact was very minimal. But there's a large portion of our society where the impact was huge, and these are people, lack of a better term, who were living on the edge, and or maybe we're just making a few steps forward, and then you get smacked in the face with COVID-19, which impacted the whole world, not just the United States, but I mean it's truly a global pandemic, something that none of us have ever seen before. And we had, there's plenty of other problems out there, but since we're talking about particular drug overdoses, I think it probably inversely targeted those folks as well for a variety of reasons, and we'll kind of talk about those as we go here. So how did COVID impact overdoses? And most of this I'm going to share with you is just data from Madison County EMS and a little bit from the coroner's office. But I think it trends probably across the state and across the country as well. So this is kind of where we were even pre-COVID. Many hospital and EMS systems were already operating at peak. Hospitals were full. Healthcare workers were at a premium, and trying to keep staffing and beds open and ambulances on the road all over the country was already difficult pre-COVID. So a lot of systems were operating extreme. Some were already broken. Some are on the verge of being broken. So, this is almost the straw that broke the camel's back when we threw in COVID on top of that, of an already stressed system. EMS is kind of an unusual character in this. We can't decide after all these years of being in existence, are we first responders, or are we healthcare, or are we some hybrid model? I think we're more healthcare. We're obviously first responders. But we have a lot of our issues that are in common with our hospital partners, our clinical partners, physicians, and that kind of thing. So the problems they were seeing pre-COVID are the problems that EMS was seeing just as well. So a lot of the support systems were not as available, when COVID impacted it, and everything from going to your normal doctor's office to maybe going to your rehab or your mental health care worker. Many of you on this call know way more about that than I do. But it's often difficult to get some of these folks to start in support systems. And once you get them in, I know the continuity of it is very important, and the consistency of it is very important. And COVID just really broke that down as far as uh, patients being able to get to where they need to be and have the kind of follow-up and inpatient and outpatient counseling services that they needed at a very crucial time. There were lots of uh, patients who probably relapsed due to depression and job loss. I would think probably everybody on this call would be remiss to say that everybody didn't suffer a little bit of depression. I mean, you just, even if your COVID impact was very minimal, you know, there were things you couldn't do and family members you couldn't see and places you couldn't go. And, you know, the whole world kind of got turned upside down in about a 90-day period there, starting around March. That things we took for granted, you know, suddenly we couldn't do those anymore. So I think that led to, you know, a little bit of depression for everybody, financial impact of it for people who, you know, had jobs that they never expected to lose. I mean, nobody probably really forecasted the impact of COVID on jobs that you think would always be around, always be hiring, and suddenly maybe they weren't there. So I think some of the people who maybe recently overcame their addiction, they lost their job, they had depression, you know, no end in sight with this particular COVID situation at the time. You know, I think we lost a lot of those folks back to relapse at that point. Another thing that, you know, that kind of happened, and this is just a product of COVID, and Judge Taylor touched on that, there was a lot of low-level offenders who were released from jail during the pandemic. Well, that had to be done, obviously, for reasons inside the jail and try to prevent COVID outbreaks in the jails and everything like that. But that also put a lot of folks kind of back on the street with no support services, no jobs to be found, you know, and I think it just kind of set them up for potential demise. And I think we saw a lot of that when we look at the numbers here a bit later in our talk. And COVID fatigue. And I can tell you, as a healthcare worker and our folks at EMS, and you talk to the hospital workers, you know, they were already stressed, as we talked about earlier, with the healthcare system, and we've had a rapid increase in overdoses and coupled with COVID fatigue. And one thing just briefly that we're doing in healthcare is a lot of overdoses. You can't get information on COVID screening questions as to whether they had fever or a positive COVID test or anything like that. So we have to treat everybody that's overdosed like they do have COVID. So that means goggles, gowns, face mask, and it's just more stress on the EMS and the healthcare workers. And you take recently two extremes of weather, you know, that were working wrecks in the summer and at 95 degrees and wearing all the PPE garb. And just recently, you know, you're trying to get people through snow and it's 10 degrees and you have the added stress of wearing all the extra layers of protection that we're typically not been wearing. So it's been hard on the healthcare workers as well. I kind of touched on that earlier, difficult access to healthcare and mental health. I know a lot of folks try to do it via Zoom and other online platforms, but I'm sure many of you can say that a lot of your patients were not able to do that or didn't participate for an extended period of time. So I think that kind of was a perfect storm that kind of hit us with really little warning. You know, we went from, yeah, there's a COVID-19 variant out there to shutdowns and our whole world changing pretty quickly, and we probably really weren't prepared for it. One thing that I found interesting is the rise in deadly cocktails. Not only did it hurt the normal retail businesses, but it also impacted the drug dealers and their supply chains. You know, some of these drugs are made in labs in other countries, so there was issues with getting drugs supplied. And often what we saw was people telling us they were buying heroin, and in fact, it was usually fentanyl. We saw very little heroin during that time. So people were not getting what they thought they were getting from their drug dealers. So it affects everybody, and Judge Taylor covered that very well. It's not just the person, it's the family, it's the friends, and it's really the whole community and really the whole country. It increases demand on EMS, police, hospitals, all aspects of healthcare and the jails. And as Reagan said, it's tremendous financial cost to the community, the state, and the nation. So if you think it doesn't impact you, and you've been lucky enough not to have anybody in your circle that's not impacted, you probably should get a lottery ticket because you're 1 in a million. It impacts every one of us out there. And I think Reagan addressed that too, but crime and associated problems, probably more than 85% of all crime is attributed back to drug abuse. And this is one thing a lot of people don't think about, but the short and long-term health issues, and this is from kind of the coroner's office aspect of it, is we often underreport drug addiction or overdose in drug statistics. Now, obviously, if it is an overdose and the labs come back and there's a large amount of substance on board that would be lethal, that's easy. But what gets missed is thousands and thousands of people who have maybe done drugs in their 20s or their 30s, and they die in their 40s and 50s from heart disease and other things that were really attributed back to their drug use 10, 20 years ago. So the number of true drug deaths in the country is woefully underreported because those will get signed out as cardiovascular disease and things of that nature, and rarely would it get attributed back to what was the root cause 20 or 30 years ago, which was the use of illicit drugs. This was some research that was done, and some of y'all may be on this call, so I want to give you credit for the researchers up there. And just looking at directly what opioid overdoses during COVID-19, they looked at 52 days before the governor did the state of emergency declaration on March the 6th and the 52 days afterwards. And they looked at the state run data. EMS daily runs for other conditions leveled or declined, and we saw that here. Our run volume overall actually went down for a period of about 60 days or so. They saw a 17% increase in the number of opioid overdose runs with transportation to the emergency department. Keep in mind, a lot of these patients declined to be transported after they received Narcan. They just want to go on about their way and not go to the hospital. We encourage them to go because we never know what kind of drugs on board. It could be long acting, and the drug itself may have a longer action time than the Narcan, so they could relapse very quickly on extended drugs. 71% increase in drugs that refuse transportation, a 50% increase in runs for suspected opioid overdoses with deaths at the scene. That's very concerning. And the average daily EMS opioid runs refused transportation increased significantly. It doubled to an average of 8 refusing transport every day during that COVID-19 period. And that's 52 days prior to March 6th and 52 days after that. So what do we see here in Madison County? This is the most alarming statistic that we had. We saw a 125% increase in overdoses that require Narcan. Now keep in mind, and most of you all know on this call, that Narcan only works with opioid overdoses, and we were seeing a fair amount of meth at that time. So this was probably truly opioid overdoses or overdoses that appeared to be opioid related. And that was from April 15th through May 15th. The thing that we kind of blamed it on, and I took some criticism for making this statement, but I still stay behind it. That is when a lot of the first stimulus checks came out. And I think, a lot of people suddenly got an influx of money. They probably hadn't had any money in some time, and they chose to spend it, obviously not so wisely, and purchase an increasing amount of drugs. But that is a tremendous increase right there. And that was right here in Madison County. Let's kind of look at some comparisons, and I hope you can see these side-by-side comparisons. If not, the next couple of pages will show them in a little more detail. But this is just looking at calendar year. The one on your left will be 2019, and this is just people who received Narcan. This is not total number of overdoses, but we only track the ones we administer Narcan to. And you can see it's 321 patients, and we gave 385 doses of Narcan. Over to your right, you will see that there's 350 patients, 454 doses of Narcan in calendar year 2020. If you can look, I don't know if this shows up, these are lines where days that no Narcan was given. If you see just the flat lines at the bottom, you can see there were several of those in year 2019. Fast forward over here to 2020, you see almost none of those. And if you do, most of them are very narrow. So you can see that the increase in frequency of overdose, and this is just charting that we pulled out of our electronic health records for calendar years 19 and 20. Maybe a little more visible here. This is calendar year 19, and you can see the days that where there wasn't as many, and then you can see the spikes. So here's 8 in one day sometime in mid-September. Here's 6 in a day back in February, back in January. And this is the 2020 numbers, and you'll see that there's another eight patient overdose day here in May. And you can see some of these from that mid-April to mid-May. You can see there's only like one day that actually there was no overdoses responded to. So hopefully that presents well, that you guys can actually see that, just to look at the difference in basically pre-COVID and the COVID year. So I'm looking at statistics. I've been tracking this since 2014. So this is just a synopsis, and in the blue is the number of patients who received Narcan on any given year since 2014. And you can see there was a fairly steady increase. 14, 15, 16, 17 was our worst year. That's when we were really at the peak of it. 18 improved a little bit, not a lot, went from 361 patients to 352. The number of doses went from 511 to 419. That's a little misleading. We changed our practice and started trying to do more IV Narcan so we could wake patients up a little more slowly. What we were seeing is mixed overdoses with methamphetamine and opioids, and we gave them the Narcan to combat the opioid overdose. And what we found out is then the opioid was gone, but the methamphetamine took over, and that resulted in some violent patients. So we're trying to do that a little smaller, in a little smaller incremental doses. So if you look at 2019 here, we'd made some steps down to 321, the least it had been since 2016. But then again, for 2020, we took steps backwards and went to 350 and 454. The next slide is really the worst slide in the whole program here, and these are deaths. And the sad thing about those is, regardless of amount of Narcan we were given, you can see that, and this is just the ones worked by the coroner's office. The statistics are actually higher than this, because some people may die days later in the hospital, or they may die in Lexington or out of county. So these are just deaths worked by Madison County Coroner's Office over that same time period. 2016 was 33, 40, 42, spiked up to 52 in 2019, and we had 59 last year. Now, what's not on this statistical bar is in the month of January alone, 2021, we had 10. That is an incredible number of confirmed overdose deaths in a 30-day period. So we're hoping and praying that slows down, because that would put us on track to have 120, and that would be nearly double. So we're hoping that trend certainly doesn't continue. But January was a brutal month for overdose deaths. So what are we doing about it? This was a few years ago. I was sitting at home. It was about 7 o'clock at night. I'm listening to the EMS radio, and we responded to 5 overdoses in about an hour and a half or less. And I'm sitting there feeling kind of helpless, like, I need to notify somebody. What do we do? And I got on Facebook, and I just put this out, and just to say, hey, there is some very strong laced drug in our area. Be careful. If you know somebody who has an addiction problem, contact them, check on them. It was really just an act of desperation on my part, because I'm sitting there feeling pretty useless while we have people in significant numbers overdosing in a short period of time. If you look here, this thing went viral, got 1.2 million hits, got shared 18,000 times, and nearly 500 comments. And I will say, all those comments were not positive. Some of them were pretty harmful, but I still stand by, what we did, and did it make a difference? Did somebody check on somebody, that may have prevented them from having a lethal overdose? We'll never know, but I think no harm came from it. So what are we trying to do now? We talk about a lot of things, and all I do is sometimes feel like I'm crunching numbers and being totally ineffective. So, we got to kind of be proactive out here. So we started in December 18th of 2020, we started a Narcan Lead Behind program. We're the first one in the state to work with the HEAL initiative. And what we do is we go out, and if we administer Narcan, we leave, and the patient doesn't get transported, we leave Narcan behind with a friend, family member, whatever, and we give them just a little bit of live training, 2 or 3 minutes. We fill out one little piece of paper that takes less than a minute so that they can track it for their study at the HEAL initiative. Is it making a difference? We won't know, but at least we're doing something. So it's not unusual. The community Narcan programs are working. It's not unusual for us to get information now that Narcan has been administered by a family member or a friend or something prior to our arrival. And that's great. That's what we want. We can't be everywhere instantaneously. So the more Narcan that's in the community, the better chance of saving lives that we do have. Their overall goal is to reduce opioid death by 40% in 3 years. I think that's a lofty goal. But if we don't set our goals high, we're never going to make the impact that we need to. And I'd love to come back in 3 years and tell you all that they've exceeded this goal. Again, we leave it with family or friends, do the live session. And we also leave some pamphlets on sources and contacts for help. So we just don't say, here's a Narcan. Next time you do it, use a Narcan. We say, here's the Narcan, use it. Here's when to use it. Here's how to use it. But here's some resources for help too. The other thing we're looking at is we're doing a thing called OD mapping. It's part of the HIDA program. It's free. A lot of you on this call could access that data as well. But you got to know where your problem areas are so that you can target them, obviously. And to just blindly look at something, sometimes what we think things are, when we look at the data, it may or may not be correct. But it's near real in-time data input from us. We fill out our EMS forms, the paramedics and EMTs do. They're uploaded usually within a couple of hours of the run. It's part of the form that we already do. And that information goes in with what kind of overdose it was, how much Narcan was given, and it plots the location of the scene. And then what you'll see, if we see the actual location, but it's a little bit protected for HIPAA reasons, and other people may just see the general location, maybe a street or a number range or things like that for that kind of data. We can look at historical overdose data, look at trends, identify hotspots, and set up spike alerts so we could have key people. And I know we have folks on this call who are working on quick response teams to really target those areas very quickly when we see a spike in overdoses. So we could set that number. If we see 5 overdoses in 24 hours, that may be our number, or 7, or whatever number we would pick up. They would send emails to alert these response teams when they get up and going to be able to do that. So again, helps focus the resources in the areas that's needed, and the partner agencies, the QRTs, QRVs, and some of them have different terminology, but they're really teams of professionals who are really going to go to the heart of the problem as quickly as they can and provide some counseling, information, treatment, whatever the case may be. This is just kind of, I'm running short on time. This is kind of how it looks. This is obviously Madison County, and this is from January 1st till the 22nd. You can see obviously the most number of our overdoses are in and around the city of Richmond, and then in and around the city of Berea, some in northern Madison County, a few out 52 going toward Irvin, if you're familiar with that area. You'll see one over into Estill County. We were called over there for mutual aid. They had somebody not far across the line who had overdosed, so we went over there to help treat that person. So this is about 7 weeks worth of data, so you can see how many overdoses that is. This is the data. We backloaded them to 2017. So this, every one of these little circles is an overdose. So you can see the number, and you can see there's areas of the county, obviously they're not as populated, that have fewer, but there's nearly no part of our county that's not been touched by it. We know Narcan's a Band-Aid and not the answer, but what we're trying to do is prevent opioid death. Give them another chance. Give them a chance to get some rehabilitation, to get some treatment and that kind of thing. So that's our part of this fight, is to really get out there and give these folks another chance. We've lost too many people. These are celebrities. you know, they had all the money and all the ability in the world, but what you're going to find in common is they all were opioid overdoses, despite access to the best care, no financial reasons whatsoever, and we still lost them. Okay, any questions?
Hey, Carlos, this is Karen. Thank you so much. I do have a few questions, and we can go a few more minutes.
Okay.
One that popped in, let me ask you, what if someone you help says they want treatment? What do you say to that person?
A lot of times what we will do in those situations, because it could happen all hours of the night, we try to transport them to the emergency department. And our fear there is not to overload the emergency department, but we want to get them someplace safe, because right at that time they may seek care, and if we don't act in 15 minutes later, they may have changed their mind. So we don't want to miss that opportunity. So we'll try to talk them into letting us transport them to the emergency department, which kind of buys some more time to get some more specific help.
Let me ask you this question too. Later today, we are going to host a session on compassion fatigue.
Mm-hmm.
As first responders, how do you and your team address compassion fatigue?
Well, I think it can be real. In the beginning, when we first started seeing big spikes of narcotic overdoses, it was as sad as the situation is from a healthcare standpoint. It was kind of rewarding that you were able to go out and truly save these people's lives with a very simple maneuver. You see so many over and over and over again, that you do have to sometimes step back and say, every one of these people is an individual. They're loved by somebody. They're not another number. It's not just another overdose. And I think you do have to do that almost on an individual basis to kind of gut check yourself to say, this is why I got into healthcare. I wanted to help people, and wow, I got a chance to really help somebody on this call.
Thank you. One more question that I see here is, when you respond to a call, how do you determine if it's an overdose that requires Narcan?
Well, you do a physical assessment on every patient you encounter, and the hallmarks of opioid overdose are typically respiratory effects, where they will have slow respirations or no respirations. And the other hallmark of opioid is pinpoint pupils. So it's really quick to assess those folks and make a determination. And what we do first of all is we'll ventilate them, to breathe for them again, while we prepare the Narcan or administration of the Narcan.
Great, thank you.